Matt Mitchell, you're Senior Research Fellow and the Director of the Equal Liberty Initiative at the Mercatus Center at George Mason University. You have your PhD in economics from George Mason University, a great school and place to get your PhD in economics. And Matt, you are one of the nation's leading experts on something called Certificate of Need laws, or CON laws. What are Certificate of Need laws, Matt?
They're basically rules that require healthcare providers to ask for permission before they're allowed to compete. And the permission is based on the regulator's assessment of whether or not the community needs the service in question.
And that there's been dozens and dozens of studies on the impact of certificate of need laws on healthcare quality and costs. What are the main takeaways from those studies?
The most studied aspect is access, and con laws are associated with significantly less access to care. Not the average patient in a certificate of need state has access to fewer hospitals, fewer ambulatory surgery centers, fewer dialysis care facilities and hospice care facilities, and hospitals with MRI and CT and PET scans. They drive longer distances to obtain care, significantly throttled care for people in those states. They also face higher costs and lower quality of care in con states relative to non-con states.
So it's what economics would predict. When we restrict competition, we get reduced access, we get reduced quality of care, and we get rising costs. Yet they persist in a lot of states. And I know your main recommendation is, from the evidence, is just to eliminate certificate of need across the board. Short of that, what are some steps that states can take to reduce the harm from certificate of need laws?
A couple of things could be done. One is simply to reduce the number of technologies and procedures that require a certificate of need. I think the obvious ones to eliminate would be those that stand in the way of care for vulnerable populations, like the certificate of need for psychiatric care facilities or for drug and substance abuse facilities. Another thing that could be done is to raise the transparency. So publicize, gather data and publicize the cost of obtaining a con. And then finally, I think states could also eliminate some of the anti-competitive aspects. The procedure is just sort of, by its nature, it's anti-competitive. But one of the things that makes it especially so is that one's competitors actually have a role in the process. So these competitors can sit on the con boards, and they are in all but 5 states invited to come before the con regulator and oppose the application of competitors. So they should have no bearing on the process whatsoever. So eliminating that, I think, would help a lot.
Yeah, I mean, I think those are pretty common sense recommendations to improve transparency and eliminate some of the problems with the con process. And I know in particular, you write that this would really help more vulnerable populations in the state. So I don't know if you want to close with a remark on that.
Yeah, I just say that, when people are not able to access care, those who are going to be most harmed tend to be low income, rural populations that otherwise don't have access to a lot of care. So for example, one study found that a large black-white disparity in the provision of care disappeared in New Jersey when a particular certificate of need law was eliminated. So those who are most likely to gain from the elimination of this law are, of course, consumers in general, but particularly vulnerable consumers in particular.
Hey, Matt, thanks so much for your work on this chapter. It's really important. It's a really crucial way that policymakers can expand access and lower costs in their states.